Ben and I both work at PwC's Health Research Institute, which is PwC's healthcare think tank. So we publish a lot of white papers about business topics around healthcare, and it's always fascinating. We thought what we'd do is talk about the consumer perspective when it comes to digital health. We've heard a lot this morning about how healthcare providers and payers and other stakeholders in the healthcare industry are connecting and exchanging information and all the complexities of that. But what we want to do is sort of bring that consumer perspective, because what we're finding is that consumers are very interested in generating their own data, controlling their own data, using wearable devices, and these are all things that are really happening outside of the health industry, but will have a big impact on what all of you are doing.
Yeah, and I think the other part about the consumer perspective is we're going to show you a lot of data from consumer surveys that we run to give you some insights into what they want. And of course, even the consumers in this room, we know that lunch is after us, so we promise we will end on time. The most important thing.
So our first couple of slides are kind of more interactive. So how many of you have a wearable device like a Fitbit or an Apple Watch?
Raise your hand. Ooh.
Wow. Wow. Actually, that's more than the American population. When we surveyed consumers, we found that about 21% had a wearable device. So I think in the room it was something more like 50%.
Or more, yeah.
I have one, my second one that I've had in the last couple of years.
You know, and when we kind of look at some of those numbers, some of our survey results show that by the end of 2014, wearable companies were shipping 7.6 million devices, and that's doubled since 2013. So we're seeing a huge increase in the devices, as well as, if you look at kind of the apps and a lot of the technology behind them, huge increases there as well.
So how about, who's been to a medical clinic or a retail clinic in a Walgreens or a CVS?
In the past 12 months, raise your hand if you used a clinic.
Yeah, yeah.
Okay.
We found last time we surveyed, actually 2013, we've surveyed more recently in 2015, and it was about 1 in 3 consumers that we surveyed said that they had been to a retail clinic. And the more interesting piece of data is what we found earlier than that.
Yeah, so if we go back to 2007, which was the first year that we asked consumers about their use of retail clinics, that number was just 10%. So it's really growing exponentially over time. The other piece of that, though, is that there's a lot of consumer satisfaction with the use of those retail clinics. So it's not just that they're going there, but the consumers are also saying they're having a good experience.
How about, would you be comfortable using a device attached to your smartphone to check for an ear infection in your child? So
How
if you
many
could
would do
use
that?
yeah, like a otoscope for your smartphone, which exists. I wish I had that when I had my kids as very, very young. I wish we had a iPhone otoscope. So when you ask consumers about that, about half say that they would be interested in that. And I think, if you ask moms and dads of young kids, I think 100% would be interested in it.
Absolutely. I mean, in fact, our pediatrician basically bought a new car on our going to him for the ear infections. So we also asked clinicians about this, and 1 in 4, so 25% of US clinicians surveyed by us said they'd be comfortable prescribing based on data that they receive from such a device. So that's the other interesting piece to the puzzle. We know that consumers want it, but are physicians going to be comfortable prescribing based on that information? A quarter right now say yes, and we think that will grow over time.
So the future of healthcare delivery, if we look at using email services, using texting, we found when we looked at Canada, because we do some research outside of the US, that in Canada, 79% of patients would be likely to email with their doctor. And I think we're seeing that more and more. Doctors are more likely to email back and forth, and patients really want to do that, as we know. So they want to communicate electronically, they want to have their fitness data electronically, they want to go to retail clinics, which are very convenient. So we see these kind of new ways of accessing care, accessing their doctor, that consumers are really pushing ahead with.
And so it's kind of wrapping it all together in terms of what they're seeing in Canada. So the CEO of the Ontario Telemedicine Network basically said that by 2020, he thinks that more than 25% of care is going to be delivered virtually. And that's when we first were doing research with him, right? And then since then,
he's upped his number to 50%. So he sees that telemedicine, especially in Canada, where you have a lot of remote populations, it's actually growing very fast and very rapidly. And we see the same kinds of things in the US, where we see a lot of sort of adoption of these kinds of ways of accessing care. So we'll kind of launch into our our report and our presentation, looking at some of the global drivers. These should be pretty familiar to everybody in the room, but here's sort of what we think of as the 7 powerful global drivers of change in the US healthcare system. Obviously, downward pressure on costs, increasing chronic diseases, we have an aging population, we have a lot of surging consumerism driven in part by high deductibles where people are finding themselves more at risk for the cost of their own care. We have the embrace of value-based models, the arrival of new entrants and innovators, which we'll talk about a little bit, and then obviously the transformative advances in technology, so a lot of capabilities that we didn't have, say, 10 years ago.
And I think why don't we tackle a little bit just on cost to begin with, and that's one of the focuses of our presentation. So here we're looking at our own, this is HRI's medical cost trend projection for the employer market. So this is covering about 155 million Americans in terms of active employees. And this is projecting out just the not premium trend, but actual medical cost trends. So that's the unit cost times utilization. But look at what's happened over the last decade. If we think back to 2000, or look back to 2007, the first time we made the projection, you can see we're at double-digit increases year over year in terms of those medical cost increases. And like we say, medical costs, they never actually go down. It's just about the rate of increase. Is it increasing or is it slowing? And over this last decade, we've seen it slowing, and now for this year in 2016, we projected a 6.5 medical cost trend. So there's a big difference between that decade at the beginning and what we see now. And the question is, why is that? And part of the answer, there's a lot of answers to it, but part of the answer we think is the reframing of the delivery system to use things like retail health clinics and technology, which are less expensive.
Have a new report for the next year coming out very soon.
Very, very soon. So we'll, in fact, in less than 2 weeks, we'll have our 2017 version that will be coming out, and we've got some good insights in there into some of the utilization, what we're seeing, and also the trend numbers, which we think will be staying flat going into next year. So. The other piece when we talk about cost and technology and consumers it's all about the cohorts and the type of consumers and patients that we're looking at. And so one of the things that we've done is really break down the US population into these different buckets of what kind of care they need. And these are really the people we think that a lot of the technology and data needs to be, and analysis needs to be focused on. It's the population that's really costing the system 80% of the cost is the old 80-20 rule. 80% of the costs are with 20% of the population, especially when we get into people with complex chronic diseases, frail elderly. And as we go throughout this presentation, I think you're going to see some of the solutions for these different cohorts in terms of how can we better manage their health and their costs.
I think we found some interesting sort of data facts that were surprising to us when we look at, say, dual eligibles, where we had kind of, I think the sort of assumption would be that dual eligibles are more unconnected to each other in the healthcare system than other populations. But when we looked, actually dual eligibles were more likely to use technology to communicate with their physicians, more likely to communicate electronically than other populations. So I think some of this, when you segment this down, some of the technology implications are surprising, and it's worth diving into these markets more deeply to figure that out. So we've done some of that research, and we'll be doing some more in the coming years. So one thing we asked consumers was, how likely are you, or how open are you to accessing care in new, non-traditional ways? And when you ask consumers that, their answer is that 82% are open to doing that. So they are open to going to retail clinics, doing telemedicine, communicating via text, using wearables, these kinds of ways of accessing care, they are almost universally open to. If you ask whether they're open to it regardless of cost, the number comes down a little bit, but it's still really high. So I think whenever we ask consumers these questions, we find that consumers are very open and very enthusiastic about new ways of accessing care that really mirror the way that they do other things in their lives, like book travel, book hotels, buy things on the internet. They want healthcare to be like that as well. And when you ask them, whether their lives are like that right now, they say no, but they really want it to be. So
maybe they're too open though, right? We've got one data point in here that shows that 55% trust the internet more than their doctors. So we apologize to the doctors in the room. The internet has beat you. The other piece of the puzzle here is, so if there's all of this activity around consumerism and the use of technology, what's the business community doing? And one of the things that we've focused on over the last few years are what we call these non-traditional healthcare companies or new entrants. And when we first started doing this analysis of the Fortune 50, what we found is that about 75% of the Fortune 50 companies are into healthcare in some way. And so they may be a traditional healthcare company, like a large pharmaceutical or insurance company, but they also may be a non-traditional healthcare company. So it could be anything from like a Costco that sells electronic medical record packages for small physician groups that sell health insurance. It could be a Dow Chemical that's selling antimicrobial carpets and paints for hospital use. It could be, like some of the speakers talked about this morning, a Google or an Apple or others that are providing technology. So we think this is a really important sector to look at, this concept of the new entrants, the non-traditional healthcare companies that are really seeing a niche. They're seeing something they can improve upon that's not being done now in the system. And they also are very, very adept at really serving consumers.
Yeah, and interestingly, several of our new entrants are automotive companies, here based in Michigan, which are looking at cars as a way to gather biometric data and what can they do in that way. So these kinds of companies are sort of investing in that kind of research and are new entrants in healthcare. So one of the things that we've been looking at HRI is the change in the way that the healthcare industry is structured. And so today, you have the government, you have hospitals, you have healthcare providers, you have insurers, and you have all of these sort of siloed groups. And the consumer, the patient, is kind of outside that and accessing it, as we are all familiar with. But what we think is happening is that the entire system is transforming into more of an ecosystem model, where it's the consumer in the middle who can kind of plug and play different elements of care to sort of manage their own health. So instead of having hospitals as an element of the system, you have all kinds of companies that can do care delivery. It might be an Amazon, it might be your local hospital, it might be your doctor, it might be a company that some little startup. And so what we see is this kind of ecosystem forming where the consumer will have more choices. And of course that makes everybody's job more complex, because that means data is going to be scattered across possibly thousands of different companies, and how do you bring that all together and make a cohesive kind of medical record, a cohesive picture of each patient. So that's one of our big messages, is that this whole world is really fragmenting in a way that's, that doesn't just include hospitals and providers, but also might include a tech company, it might include an Amazon, it might include a Costco. Who knows? It's a lot of different companies coming into this field, and they're all looking at all these elements: care delivery, diagnostics, and therapeutics, and there'll be players in there too.
Yeah, I think that's that's kind of the issue here that Trine alluded to, which is how do we connect all of this up? And we look at digital health really as the nerve center, and we're going to be asking more of the digital health system than ever before. I mean, again, kind of starting from where we were this morning, talking about the interaction between health systems and physicians and others, and now Trine and I are bringing into it a whole nother layer of the world, which are consumers. And it's not just consumers when they interact with the health system. I think you're going to see on the next slide how it's also interacting in every aspect of their lives.
That's right. So I think this morning I saw an interesting article that came out of the ASCO conference. And what it was about a tech company that had managed to connect people with diagnoses of pancreatic cancer and their early searches on a big search engine. So what they said was, if we have people who have pancreatic cancer, can we look and see what they were searching for in the months before they were diagnosed and see if there was any correlation between that and their diagnosis? And is there a way to look at these search engine searches and say, this is an early indicator of pancreatic cancer, this kind of panoply of searches or search terms. And they found actually a correlation, and it was just published in the ASCO journal, between search terms and diagnoses of pancreatic cancer. And so this company is thinking beyond that, can we create a service where we look at search terms and see if there's correlation between certain diagnoses, and then can we sell that to providers, or can we sell that directly to the consumer, or make it a sort of aspect of our search engine that makes it especially valuable? And so this is kind of where we look at health data as a much broader kind of thing than just an electronic medical record or a claim. It's beyond that to entertainment data, search terms, that kind of thing. All these companies that deal with that are thinking about this. And I think we're going to see going forward health sort of be a much broader kind of consideration, especially when it comes to digital and data.
I think one of the areas you see that especially is in the home monitoring area. A lot of security companies have also gone into home monitoring of health as well. So there's a great example of how we're talking about this moving outside of traditional health.
I was talking to a retailer, a large retailer you've all heard of. One of their executives that's doing healthcare there was talking about how they were looking into how you could use shopping data to be early indicators of health issues. So for instance, could they take shopping data when it comes to sizes of clothing for a family? And if the sizes of the clothing were going up in a way that was sort of not, associated with a child growing, but an adult, if they were buying larger and larger sizes of clothes, could that be kind of an early indicator of weight gain that wouldn't show up, until the year or two later when they show up in the doctor's office with a much larger weight gain? So they're looking at shopping data and patterns to connect that with health. And so again, this is an example of how can you use all kinds of different health or all kinds of data to sort of do indicators for health in particular.
Or that could just be creepy, actually. Yeah. Let's be honest. So just kind of wrapping up this section a little bit, 3 key areas that we see in this convergence of digital and physical sites of care. So we've kind of woven through, we've got retail, we've got the technology piece, we've got it in the home. Part of that is being driven by consumer empowerment. These are desires from them to have a great experience in the health system like they have in other systems they are spending money in. The other part of it is, sure, there's a technology aspect, but we would like to remind people that it's not just the technology, it's actually the systems and the innovative business models that are behind that technology. The technology is just an enabler. And then the third point we're seeing are these new access points, and that can be technology, but can also have a physical aspect to it as well. and we'll walk through some of those.
So we did a piece of research a few years ago where we asked consumers if they would be open to a certain kind of new way of accessing care. And what we really did was we took a familiar way of accessing care and then just kind of moved it one step closer to the home. So would you be interested in using an at-home strep test? And over 50% of consumers said that they would be interested in using an at-home strep test. And I mean, I don't know who would say no to that. I would have loved that, right?
Great.
How many times you go to the doctor to see if your child has strep and it's not strep, or you wait too long and they did have strep, that kind of thing. Who wouldn't want that, right? So 60% almost of consumers said that they were interested in that. Evaluating minor skin conditions via an email or an digital image, over 50% were interested in that. Same with the ear infection and the sort of smartphone otoscope. Almost half of consumers were interested in that.
Well, and I think that if I could just add in here, I mean, so think about what those numbers mean to the primary care system. When you start pulling out strep test, ear infections, you're creating a lot of virtual space in the primary care system, and those are millions of visits that are happening each year, so that's a real possibility.
Yeah, when we looked at, there were 12 different kinds of services that we asked, sort of hypothetical services that we asked consumers about. When you compare that up with how much revenue do providers get for providing those services, it was about $64 billion a year, just for those 12 kinds of services. So this is a very tiny tip of the iceberg kind of part of the healthcare system, but it adds up to a lot of real dollars. And there are companies that are working on developing all of these or have already done that. With the otoscope is already out there and for sale for $99 to any consumer who wants it. So these kinds of services and devices are being developed or are already there.
So I think the question that we always get when we present this research is, this all sounds great, but it's really just the millennials who are interested in a lot of these new innovations. And the survey data actually shows otherwise, that there is interest really through a lot of different age cohorts. And in fact, the 35 to 54-year-old group was the most interested in some of these technologies. So 50% were to use some of these DIY technologies and things of that nature. But if you take a step back, it makes a lot of sense, right? I mean, millennials are not necessarily facing a lot of health problems yet, where that 35 to 54-year-old cohort, you're dealing potentially with older parents, their health issues. You might be dealing with your children and their health issues, and then of course your own health issues as well. So the point we want to make here is that technology, that the consumer technology is not just an interest by a small niche of people. There's a growing interest across all demographics.
I just think about from my own life, my father-in-law is 90 years old and has mobility issues. He uses a walker. And I would love, and my husband would love to have just a Fitbit or some kind of wearable that he could wear that would let us know whether he's taking more steps per week or fewer. And that kind of trend over time, you could see, is he sort of staying the same, or is he sort of losing out and doing fewer steps a week? And so that kind of thing seems very simple, and is part of where I could see a lot of value coming out of the system with this kind of technology. So if you ask consumers what they think about wearables and what they hope for out of wearables, they are wildly optimistic. 56% think that wearables alone will add 10 years to our lifespan.
Put on 2 of them, please.
Wearables, antibiotics, and vaccines are going to be the great advances of mankind. 46% think that it will allow us to monitor our nutrition and control our weight, and 42% think that'll allow us to be much better athletes. So people are very optimistic. We actually ran this exact same survey this year. This was from a few years ago, and the numbers were even higher. So consumers really have a very positive view of wearables and this technology, and have really high hopes for it, perhaps too high.
That's the retail advertising.
Yeah, they believe the advertising.
The other thing, looking at adoption rates, so here we're looking at mobile health applications doubling in 2 years. So last year in 2015, when we asked consumers about their use of mobile apps, 32% said that they were using them for health purposes. But just 2 years ago, that was 16%. So we've had a doubling in 24 months. I mean, that's an incredible rate of increase. We don't see any indication of that slowing. So, and then in fact, also through other studies we've seen, if you look at something like Apple's App Store and development, I mean, the #1 type of app that's being developed now are not games, but actually health apps. So a huge interest there as well.
If you ask consumers how much they're willing to pay for one of these devices, the amount is pretty low. It's 0 or less than 0. They want to be paid to use it. So, so they're really interested in getting these devices from their employers, from an insurance company. They're even in great numbers willing to take one for free from their insurance company or their employer and share their data with those entities in exchange for a free wearable. So I think people, if you break it down in terms of age, older folks are less likely to share that data, but if you go down to a millennial, they don't care. Large numbers of them are happy to share their health data with anybody in exchange for a free thing, so.
And there's just some examples up here of technologies, DIY technologies. We talked about the otoscope and things like that. I think the other point that we make here is this is a system of a lot of change. We're going to see some of these new entrants make devices and new technologies that are going to be adopted in a very widespread manner. We're going to see a lot of them fail along the way as well, and that's one of the things that happens when there's a kind of a big time of creative destruction going on out there. And we've already seen some of that on the retail clinic space and some of the devices that haven't had widespread adoption now. But when you see some of the bigger technology companies, things especially that work with our handheld, our smartphones, there's a lot of opportunity there for staying power.
One of the examples that we like to talk about is this company out of Atlanta that has pulled together a network of emergency room doctors to work off-duty as telemedicine doctors. So you can, if you download the app, you can push a button, kind of like Uber, and within a minute or two, an ER doc who's off duty will come onto your screen and do a telemedicine visit with you for $100 cash. So you cannot send this through your insurance. You pay with a credit card, like with an Uber, and this has been incredibly popular, even though people know that they are not going to get reimbursed for this. I think a question for everybody in the audience is when these kinds of companies pop up, how are they hooked into the HIEs? How are they hooked into the networks? Are they part of the network? They're not coming through payers, they're not coming through claims, they're not really a big provider. So how do you pull this kind of data in and include it into that whole picture of a patient? One of the interesting little tidbits about this company in particular is they started off thinking they were going to do a subscriber service, and you could pay like a set fee per month, and you would be able to access the doctors as often as you like. And they thought, people will probably dial in like twice a year or so. That's how often they usually go to the doctor. And people were pressing that button like once a day. So they decided that that was not a very good sustainable business model, and they went to basically a fee-for-service model, and that has worked out very well. they're finding that the people that are dialing in are not just sort of busy, affluent parents, which is also what they kind of thought they were going to get, but it was teachers who don't want to take a day off from school. It was waitresses who don't want to miss a whole shift going to the doctor. So they found that the demand for this kind of thing was pretty high. People were willing to pay cash, and this is the kind of thing that will complicate all efforts to sort of pull in all data together.
Yeah, and I think the other piece about virtual health is that clinicians also, there's a lot of clinicians that like it as well. It gives them the ability to work after hours, on weekends, at odd times that may fit their work-life quality. You know, one of the things that we mentioned is it's not just about pure mobile and personal technology. We're also seeing the traditional health system rebuild their infrastructure more in a virtual manner. So it's not just the retail health clinics, it's also things like bedless hospitals and virtual hospitals. So these multi-specialty clinics, they may have an ER, may have ORs, but they don't have the cost infrastructure of inpatient beds. They can have a smaller footprint, they can put them closer to the community where people can access them. We're seeing a lot of interest in these in the traditional health system, these kind of bedless and virtual infrastructure going up.
So this is probably a familiar kind of stat for everybody. I'll just go over it real quick, but we're just seeing there's been a long time trend of inpatient visits shrinking and outpatient growing, and we see that outpatient growing sort of continuing on into venues that are closer to the home, and then on again into the palm of your own hand. So you can imagine that sort of taking that extra step, not just an outpatient clinic, but to that retail clinic, to that home visit, to that your smartphone in your hand.
And let's see, so here's the outpatient and the virtual all coming together. What are the things, a lot of employers are very interested in virtual care. Here's a model that we did if you're looking at a diabetic population of 100,000. We looked at the utilization, the standard utilization. This is based off of some VA data that we were able to analyze. And so you're seeing here, inpatient, ER visits, with no virtual visits in terms of how many are set up right now. Now you put in a virtual visit in place, and you can see a reduction in cost of almost 10% for that same patient population. But more importantly, it's not just about cost reduction. This patient population is actually getting more touches with the health system because you can have more virtual visits in terms of monitoring a chronic condition when you're and keeping people out of the ER, keeping people out of inpatient beds.
So one of the things that we've also seen is that a lot of the innovation in all of these sort of virtual care venues and ways is outside the U.S. So countries, emerging markets are developing very innovative ways of connecting patients with doctors, or ways of using algorithms to sort of do that first triage. A lot of this is happening outside of the U.S., and those innovations are being brought back to the U.S. So when you look for sort of innovative ways, one of the things to do is just look at what other, especially emerging markets that have big gaps in terms of access to care, what are they doing?
And then what's the kind of the next step after this? So one of the things that we're working on research right now around is 3D printing, and we think there's a lot of promise there. In fact, the FDA just put out some guidance around 3D printing this last month. And so now we're going to be able to actually deconstruct even kind of our manufacturing facilities, if you will, and prosthetic devices can be customized and made in the community. It's possible that we'll start having some level of drug manufacturing also through 3D printing and implantables. So we expect to follow this over the next few years as well as it takes off. So wrapping it all up, and I think we've got a couple of minutes for questions, so maybe be thinking about your questions, but we wanted to leave you all with what we think kind of the 4 most important attributes for organizations to thrive in the future will be, and I'll go over a couple of them, but one, and we've hit on kind of throughout this presentation, which is you have to be very, very receptive to consumer needs now. They're paying more out of pocket. It's extremely important to them. I think the second thing you can certainly take from the presentation Trine and I have been giving you is around partnerships. There's a lot of non-traditional healthcare companies out there, telecom, retail, hospitality, and we're seeing many, many collaborations between traditional and non-traditional out there.
And then also, obviously, very familiar to everybody, smart analytics, so bringing in that analytics piece to deal with all of this data. You can imagine not just the EHR and claims data, but then you've got, what if you're dealing with, shopping habits or travel habits or fitness and steps, all of that data. How do you actually deal with that? That's obviously one of the big questions that lots of companies are working on and that everybody in this room is dealing with as well. And then operational agility, obviously doing things in an efficient way. And that too obviously takes up an enormous amount of resources and is important. Okay. So I guess we could, if anyone has any questions, we're happy to answer before lunch. Yep. I think we have one right down here.
I think they're bringing the microphone over. And while they're bringing that over, just as a mea culpa for us, when we got up here, the timer wasn't working. And so all of a sudden we had 40 minutes to 30.
Okay, hi, my name is Kathleen Connor, and my question is, we know there's a difference in patient data sharing rights in Europe than there are in the US, and especially the right to be forgotten, which has sort of had a lot of controversy around it, but that has been passed. What are these innovative business models thinking about, when they think they are going to be tracking travel habits and the size of clothing, and then trying to get rid of that information if the data subject says no? Is that being considered in your research, or by these vendors? Thank you.
Well, it's such an interesting question, and I think there's a huge contrast in terms of privacy in the U.S. and privacy laws and regulations, and in Europe, and that contrast is that we don't have that right to be forgotten, and we don't even really have a powerful movement around that in the U.S. If you look at attitudes of, say, millennials, there's not that high priority if you ask them about that as well. And so as you see them, especially when you come to health data, as they become more engaged with the health system, they become older, they start having babies, they start getting sick, and it'll be interesting to see if those attitudes change. But if they don't change, I don't know if that right to be forgotten will become a powerful thing. When we talk to tech companies here, this question does not come up. Yeah. Yes. Yeah. They have, when they're looking globally, they'll have then you look at what a country like China does in terms of a whole different kind of approach to data and a control of data. And then, so I think these companies are thinking, obviously, globally, but they're not going to do a blanket universal policy for everybody. They're going to do what's best, in each country for them. Yeah, so.
One more question. Who's got it?
Yes.
I asked the advisory board the same question when they published a survey a few months ago, and the question comes around the data sources. Quite often it's the method that you use to survey that predicts the results that you're going to get. Were your surveys encompassing of people who either are comfortable with technology or didn't use technology? So did you use paper, or did you use in-person interviewing? Did you use just technical?
No, so we did online survey of sort of a wide demographic. So we tried to match the demographics to the U.S. population using a firm that does online surveying. The sort of next step for that kind of thing is to go to telephone, but there's a lot of complications with both. There's sort of pluses and minuses of all kinds of surveys. So we. Yes, absolutely. If you're not going to capture on an online survey people who don't have Wi-Fi access. Right.
What's interesting, though, is even though there's some inherent bias in that, I mean, what we've also found is that it's not necessarily based on income. It's more of around age. We found almost all income groups are, have some sort of access online, through smartphones and things of that nature. So that was kind of an eye-opener for us. But there's certainly some populations you're not getting to with a online survey.
So I would definitely say that, that's a consideration, that these are folks who are online, definitely, yeah. Anyone, any other questions?
We're out of time.
Okay,
Thank
thank
you
you
all.
so much.
Great job. Thank you.